Hello, my YouTube family. Welcome again. My name is Dr. Lee, and welcome to another one of my Prometric demonstrations. Today, I want to demonstrate providing mouth care, brushing the teeth. This will be done on a client, and your client will be laying in the bed, supine, flat. That will be the startup position for this skill. So, if you enjoyed the video at the end, please hit the subscribe button below. This is how we're able to keep the videos on YouTube. Give me a thumbs up. I would appreciate it. Any comments or questions that you have about this skill, please leave them below. I'm real good at trying to respond to everybody within at least a couple of days. Okay? So, with that, I'm going to go ahead on, close the door, and start this demonstration. So this is providing mouth care to a client according to Prometric guidelines. All right, let's get started. Good morning, Miss Mary. How are you doing?
I'm fine. How are you?
I am doing fantastic, fantastic. My name is Dr. Lee, and I'm here to provide mouth care for you, which means I'm going to be brushing your teeth. I'm going to wash my hands, gather my supplies. Is that okay?
That's fine.
Great. I'm going to go ahead on and close the curtain so that I can provide for privacy. I will look at the evaluate at this point and say I washed my hands. Now that my hands are clean, I can go to the patient's bedside where their chest is and gather my supplies. So for my supplies, let me get back in view of the camera. I'm going to have a cup of water for the person to rinse their mouth out with, 2 linen protectors or 2 large towels, 1 to drape the table with, 1 to put across the person's chest, a pair of gloves, these are required, toothbrush, toothpaste, and an emesis basin. So this is everything that I want to bring back to the patient's bedside, okay? All right, Miss Mary, hi, I'm back.
Okay.
I'm going to stand on the other side so that my YouTube family can see what I'm doing. All right, I'm just going to put everything down here on the table, and then we'll get the head of your bed up. Okay, Miss Mary, I'll be raising the head of your bed up. I need to bring it all the way up, okay?
Okay.
So make sure you put the head of the bed in Fowler's position. This is to prevent aspiration while you're doing mouth care. So Miss Mary, we're coming up. We got a little bit more to go. I tell my students, do not ask the patient, is this high enough? Because your partner may say yes, and you stop here and start doing mouth care. You will flunk because you don't have the bed up to at least 60 to 90 degree angle. So I'm going to continue. Miss Mary, we have just a little bit more to go.
Okay.
I'm going to get the bed all the way up. Okay, we don't want you to choke. Once I have the bed as high as it will go, I'll say, okay, Miss Mary, that's good. I hope you're comfortable. Okay, great. I'm going to take a clothing protector and put across Miss Mary's chest. All right. I'm going to don my gloves. Put on my gloves. Okay. Now that I have my gloves on, I will touch her toothbrush. It should be sealed at your test site. So I'm going to go ahead on and remove the plastic. Now, Prometric wants you to moisten the toothbrush. You have a couple of ways that is acceptable according to Prometric for getting the toothbrush wet. One way, the cup of water is clean, the toothbrush is clean, I can stick it in the water. That has moistened the toothbrush. The second way, I can take the water, Put the toothbrush over the emesis basin and wet it that way. Don't care, but you must wet the toothbrush. After the toothbrush is wet, then I will apply toothpaste to the toothbrush. Miss Mary, we just getting set up here, okay? You still doing okay? Okay, great. You don't need that much toothpaste on here, just a little dab. Let's say a little dab, but do it. Okay, now I want to start brushing all surfaces of the person's toothbrush and try to get around the gum line. I like to start with the patient's teeth clenched, like this. So I will ask the person to clench their teeth. You can start with the mouth open. It's your choice. But you must clean all surfaces of the teeth and gum line, front and back, and get the person's tongue. Okay? So Miss Mary, I'm about ready to start. If you can clench your teeth in the front. Okay, great. I'm getting the front up and down. I'm gonna go to the side, get the top, bottom. Okay, other side. Let me turn my toothbrush around. Get the top. Okay, bottom. All right, great. So Miss Mary, now can you open your mouth? When she opens her mouth, I'm gonna get the back surfaces of the teeth. Get it in the back. Okay, here, here, here. In the back over there. Great. Okay, top, back, and back over here. Okay, now that I've brushed all surfaces of the teeth, I'm gonna ask Miss Mary to stick her tongue out. Now, when Miss Mary sticks her tongue out, I don't have to just keep going all the way back and getting the whole tongue. Remember, a lot of people have a real sensitive gag reflex. And I just get the tip of the tongue that's hanging out, brush it a couple of times. That's all you have to do, and you'll get credit for that part of the skill. Miss Mary, if you can stick your tongue out, that's it. Okay? I can put this down on my linen protector that's on the table. I'm going to give her some water to gargle with. Let's talk about this emesis basin. This curvature area of the emesis basin goes next to the chin. Whether you put it here, some people do it here, but it's to go around the chin. I don't bring it to the patient this way. All right? Curvature, chin. So Miss Mary, I have some water. If you can take this, rinse it, gargle. When you're ready, you can spit in here. Would you like some more?
No.
No? Okay, great. You only have to rinse the mouth out once. If your client is okay, then that's good. They don't have to finish up all the water that you have there. At this point, I can take my clothing protector, clean the resident's mouth, and I'm pretty much through with the resident as far as mouth care. Keep your gloves on because now you have to dispose of the things that you use. So I'm going to take the emesis basin, the cup, toothbrush, and bring it over to the sink. And I'm going to push the curtain back just a little bit to make sure you can see me at the sink. The water that was in the cup, I'm going to pour it out. The secretions in the emesis basin, I'm going to pour out. My plastic, I'll put there. Now, the cup can go in the trash. Let's talk about this toothbrush. Prometric does not give any guidelines for the toothbrush. So you can throw the toothbrush away or you can rinse the toothbrush off and put it back. Prometric don't care. After you've brushed the resident's teeth and tongue and gum line, do what you want with this toothbrush. I'm going to go ahead on and throw it away because Prometric does not give any guidance for the toothbrush. Okay? I'm going to turn the water on. I can turn it on with my gloved hands because these are dirty. The water faucet handles are dirty. I have emptied the basin. I'm going to rinse it. Then I'm going to dry the basin. I'm going to put my toothpaste back into the basin. I'm going to go ahead on and turn my water off. And I'm going to get a dry paper towel to put this up and open up my drawer so I can put it back into the patient's top drawer. Okay, now that I've put that away, I'm going to come back and get my towels. These will go into the dry linen container. I'm going to look around before I take my gloves off to make sure I've put everything up. The clothing protector's put up, the linen is put up. I empty, rinse, dried the basin. I put that back, toothpaste back. I got rid of the toothbrush. Okay, so I feel comfortable. I'm going to go ahead and take my gloves off. I wash my hands, okay? And at that point, I'm ready to come back to my patient. So, Miss Mary, how are you doing?
Okay.
Great. All right, so I'm back. I want to give you your call light in case you need to get a hold of me. You can just push the red button. Would you like a light on, magazine, or anything?
No.
Okay. I had pushed the curtain back a little bit so you can see me at the sink, so that's why I kind of brought it back. So now I'm ready to open the curtain because I'm ready to go. Okay, you're good?
Fine.
Okay, once more, I'm going over in my head, make sure I did everything. I will look at the evaluator and say I washed my hands and I'm through with that skill. So this is brushing the teeth according to Prometric guidelines. I hope you enjoyed it. If you have any questions, again, be sure and leave them in the comment section, and I will see you in the next video. Goodbye.